Being an occupational therapist is an exciting career because every day I get to help people. People almost always make some kind of progress when they come to the rehab hospital, so it's good to see their improvements and their family be excited about the progress that they've made. It's pretty much hands-on right away. I mean, the science coursework, there's some things that are more by the book, the neuro and that, but then they also get you over in the cadaver lab and neuro lab, and right away we started learning things like range of motion and manual muscle testing and practicing them on each other, and there's a lab component for every quarter of classes. The faculty at Midwestern is very open and very interactive. They're very approachable. The nice thing about the large majority of the staff at Midwestern is they're still actually practicing therapists. So they're getting out there and they're still doing the work and they're seeing what's going on in the clinics and coming back and able to relay that experience to us and put it on a more practical level of what we actually need to know as compared to what's just in the book. In the Allied Health building, we have a lot of classes that we take with the physical therapist, with the physician's assistant. So we get to meet them and figure out what they're learning and kind of learn some of the stuff that overlaps. So it creates a more interdisciplinary team, which is what you actually get when you get out in the field. They have a couple of courses on business and administration here that are in the occupational therapy coursework. We did things where we had to develop a business plan to start an OT practice, and it was from the ground up, creating a budget, creating an action plan, your marketing plan, giving a presentation to a board of businessmen and having them review it. But probably the most nerve-wracking part was going into the fieldwork experience that you have at the end of your classwork at Midwestern, because now you still feel like you have all this book knowledge and you've learned all these things, but how do I apply it? And it's really surprising how much you actually do know when you get out there, and somehow things start coming out of your mouth and they make sense, and then you start treating it and it works, and in the end the preparation was there, the foundations were in place. The Occupational Therapy Department at Midwestern has an extensive set of contracts with health facilities all over the country, in pediatrics, inpatient, outpatient, hospital, home health, and we use those for our fieldwork experiences. And I actually, for my very first fieldwork experience, I went out to Las Vegas for a week and worked at a hospital out there, which was a fun experience. And then to come back here and work in an outpatient pediatric setting and acute care inpatient rehab setting, any kind of area you want to go into, they have something that will fit that.
How's your weekend? Weekend was good. Yeah? I'd say it was too relaxing, but
There's a lot of fun things to do at Midwestern. We always say we never laughed more than we did in class at Midwestern, because being such a small class, we spent so much time together, like 8 hours a day in class every day with the same 12 other people and your professors, and you're learning and going through all these experiences at the same time, and so it made it a very supportive learning environment that way, because it is a smaller campus, a smaller community. There's lots of good friendships develop, and there's always something to do. One of the things they do at Midwestern, they're very supportive in their student program and very concerned about how you're doing even once they place you in your fieldwork experiences. But they're constantly checking in, making sure you're doing okay, and they make sure that you get placed in enough variety of settings that you're prepared for any of the questions that they might ask you on the board certification exam. Midwestern did a very good job preparing me for my career as far as background knowledge, the things I needed to know scientifically, hands-on practice, but also it gave me those interpersonal skills and the confidence that I needed from the small group setting and the one-on-one individual attention to go apply it out in the field in new situations with new people and just keep learning from there.